Hello, welcome, thank you all for coming. Tonight's meeting is all about the health of our children at school and at home. Children's health can be defined as their ability to individually or in groups develop and realise their potential, satisfy their needs, and develop the capacities that allow them to interact successfully with their biological, physical, and social environments. As I'm sure you are all aware, we live in a remote area of Australia, and this results in many difficulties surrounding healthcare access for ourselves and especially for our children. This is highlighted by Royal Far West, who have identified there being 300,000 children in rural and remote Australia that are unable to have their health needs met locally. Issues such as developmental and behavioural disorders, mental health challenges, delayed speech, poor motor skills, dyslexia, oral health, and poor diet are all prevalent among these children. Statistics gathered by the Australian Institute of Health and Welfare further describe the type of issue we are facing, stating that on average, Australians living in rural and remote areas have shorter lives, higher levels of disease and injury, and poorer access to and use of health services, compared with people living in metropolitan areas. This, of course, impacts our children in many ways. Not only do rural and remote areas lack access to healthcare, we have a higher proportion of children aged 0 to 14 living in rural and remote areas, at 22%, compared with 19% in major cities and the same in regional areas. Australia is comprised of a vast and diverse geographical landscape, and this has resulted in a long-standing issue around healthcare access. For this reason, it is obvious that we are at a disadvantage regarding healthcare access, especially emergency situations when minutes can be vital to saving someone's life. This is regarded as one of the main factors for poorer health in rural and remote areas. Plus, a lack of healthcare workers in rural and remote areas only makes this issue more difficult. Our children have limited access to telehealth services as well, which can include psychological care. The long-term effects of unmet psychological needs can result in these children having poorer education, psychological and social outcomes. Population groups which are especially disadvantaged by the lack of healthcare services in rural and remote Australia are Aboriginal and Torres Strait Islander peoples. Although Aboriginal and Torres Strait Islander peoples only make up 5.9% of Australia's children, they represent 34% of the total Aboriginal and Torres Strait Islander population. Alongside this, 61% of Aboriginal and Torres Strait Islander peoples live in major cities. However, they make up 47% of the population in very remote areas. The Australian Institute of Health and Welfare's report on Australia's children identified priority population groups which are deemed as most vulnerable and in higher need of support and services. Unfortunately, children from rural and remote communities are highlighted as one of these groups. This reiterates our need to facilitate change in these children's lives. Children born in these areas are already more likely to start life with a disadvantage. This can be seen with the rate of mothers who smoke while pregnant being higher in very remote areas. The birth rate of babies is also significantly lower in very remote areas. One of the most shocking statistics, though, is the higher rates of death among infants and children. In 2017, it was reported that there were 2.9 infant deaths per 1,000 in major cities and 5.9 in remote and very remote areas. In 2015 to 2017, child death rates compared at 9.4 per 100,000 in major cities and 25 per 100,000 in remote and very remote areas. There is also a significant difference in the rate of hospitalised injury cases, with 2,617 per 100,000 children in very remote areas, compared to 1,342 per 100,000 in major cities. This is almost double the amount. This is also the case for hospitalised cases for assault, with 87 per 100,000 children in remote and very remote areas, and 50 per 100,000 children in major cities. These statistics only amplify our necessity for healthcare services in rural and remote Australia. Within the report of Australia's children was also statistics on school attendance rates, which in a moment I'll explain the connection between healthier children and higher academic achievement. The rate of attendance for Year 5 students in 2008 was 77% in very remote areas, compared with 94% in major cities. Also in 2008, Year 5 students in major cities recorded literacy and numeracy rates at 96%, lowering to 85% in remote areas and a shocking 54% in very remote areas. There are many factors contributing to the issue we face with the health of our children. Although we clearly have a higher need for medical services in a range of healthcare areas, there is a lack of healthcare workers in remote and very remote Australia. These shortages are linked to a difficulty in recruitment and retention and having the appropriate distribution of services and practitioners to these areas. Even with more workers in rural and remote areas, we still face the difficulty of having the right expertise and specialists in the area. Geographical location and distance are directly linked to the causation of this issue. The vast distances which need to be covered, sometimes only for a 15-minute appointment, can be deterring for people in need of the service, and unfortunately the children can be at the detriment of this. The distances to healthcare services can limit emergency care as well as preventative care, impacting all types of healthcare needs such as screening, diagnosis and treatment of disease and injury. People living in rural and remote Australia can easily fall into the low socioeconomic bracket, which can be another factor which provides difficulty in accessing healthcare. Distance and the dispersion of people across our land also caters for difficulties in providing services, as they also produce higher costs for both those providing the service and those who need to access it. The lack of services and interaction with medical professionals can also account for a lack of health literacy in rural and remote areas. The lifestyles of people living in these areas can be characterised by unhealthy behaviours and reflect a lack of knowledge given by healthcare workers. This is another opportunity for our school to educate our children in the importance of health and how as a community we can overcome the statistics of poor health of our children in rural and remote areas. One way we can try and fix this issue is through the implementation of telehealth services. A telehealth program can be used as a real-time face-to-face service via video link. Health professionals would be more accessible and higher levels of consultations and support would be offered to help families and their children. This would also cater for mental health needs of the children, as they would have access to specialists such as a child psychiatrist. The use of telehealth services to deliver allied health therapies can over time improve academic outcomes. With our children becoming healthier and more engaged in the community, attendance can rise and academic achievement will naturally follow. This instills a long-term benefit for the future of our children. Organisations already implementing such services, like the Royal Far West, rely on the help of schools, families and local health services to work together for the success of such programs. There is evidence which demonstrates the importance of strong community involvement in increasing this access to healthcare. By doing so, not only would the health of children improve, but we could achieve community-level outcomes which support everyone. This method tackles the issue by addressing the factors associated with family, community, society and the environment, a direction that paediatricians are encouraged to focus on while addressing health issues. It also allows for the empowerment of children and families to be directly involved in the management of the child's health. Telemedicine also allows for connections at local levels, hospitals and specialists. With most people, homes and schools having technology such as mobile phones, tablets or computers, this service becomes extremely accessible, and using the internet can even connect people internationally, if needed. Depending on the situation, it can be useful in extreme situations by advising a local of medical information or help someone with a chronic condition needing regular appointments. Aboriginal and Torres Strait Islander peoples will also have access to people with knowledge of diversity and accommodating different needs. This can help close the gap that Aboriginal and Torres Strait Islander peoples face when comparing their health to those who are non-Indigenous. As you can see, there is a multitude of information pointing towards the positive impact telehealth services can have on our children's health. I encourage you to engage with these services so that everyone can benefit as much as possible. Thank you for coming tonight. I'm looking forward to the changes we can make as a community. I hope you can see the role we can all play in implementing this strategy for the benefit and health of our children, our communities, and others across Australia.